birth defects and grotesque mutations and deformities across Europe. In 1962, my uncle John F. Kennedy honored Stewart with the President's Award for Distinguished Federal Civilian Service, the government's highest civilian honor. The greatness of NIH was rooted in its unimpeachable integrity. It truly deserved the reputation for conducting science in the public interest. Countries that didn't have their own research institution, for example, the new countries of post-colonial Africa, trusted American science so much, and many of them wrote into their own laws, if the FDA approved it, then it's approved in our country as well. I want the agencies under HHS to earn back that level of global trust. And what is the path to public trust? The path to trust is always through transparency. Transparency is the foundation of science, and it is the foundation of democracy. I think it's significant that an overwhelming majority of the men who signed the Declaration of Independence, who were this nation's founding fathers, were also citizen scientists. These included Thomas Jefferson, George Washington, John Adams, James Madison, Benjamin Franklin, Benjamin Rush, a physician, Julian Bartlett, a physician, Matthew Thornton, a physician, and Oliver Wolcott, a physician. Science and democracy were born together during the Enlightenment, and they share the same ideals for openness, for public access, and for transparency. Science and democracy flourish from the free and unimpeded flow of information. No one trusts science that isn't transparent about its research hypothesis, its raw data, or its conflicts of interest. No one trusts a government built on lies, on secrets, on cover-ups, and propaganda. That's why my uncle famously observed that the word secrecy is repugnant to a free and open society. Healthcare policy has been the subject of intense controversy for 20 years. But have you noticed that the controversy is almost entirely about who pays for it? Republicans and Democrats fight these ferocious battles on Capitol Hill, and it's always about who to shift the burden of paying for it. And for me, I've said before, this is like moving deck chairs around on the Titanic. Our health is getting worse and worse. And when the total costs are over $4 trillion as they are now, there is no good solution, only less bad ones. We need to start asking a very different question. Regardless of who pays, why are we paying so much? Well, which is, by the way, 2 to 3 times what European nations pay for better, for worse health outcomes. Well, corruption and efficiency may be part of it, but the main reason is quite simply that Americans are very, very sick. We are, in fact, the sickest nation on earth with the highest chronic disease burden in the world or in the history of the world. During COVID, we had in this country 16% of the global COVID deaths. We only have 4.2% of the world's population. So something we were doing was utterly wrong. And the CDC says that's because we're the sickest people in the world. They say that the average American who died from COVID had 3.8 chronic diseases. So were they dying from COVID or were they dying from chronic disease? According to some estimates, 90%